There are hundreds of people sitting in jail cells this evening that have been there far longer than they should be. We don't even know, in fact, if they're guilty or innocent. Colorado's backlog at the state mental hospitals has forced long delays in criminal trials. Our Kelly Rinke shows us this evening why beds are now hoping to change that.
A case in Boulder begins with a call to a Lucky's Market. Police respond and find Patricia Murphy inside, holding a knife court documents say she used to stab an officer. Murphy's court case is now on hold because she's too mentally ill to stand trial.
A year ago today, while our wait list sat at about 445 people or so waiting in jail, today we're at about 240.
Leora Joseph is the director of the Office of Behavioral Health. The wait list for treatment is the lowest it's been in years since the pandemic.
We were able to offer incentives to our nurses to come and work for us. We opened 44 new beds, forensic beds, at the Fort Logan State Hospital, which had never had forensic patients. We've been contracting throughout the state.
The state is still far from compliance under a consent decree. Because of the backlog, they entered into an agreement in federal court in 2019 to meet certain deadlines.
We are working hard. The consent decree gives us until the end of 2027 in order to be in compliance.
Under the consent decree, Colorado is required to get people into restoration treatment within 7 to 28 days. As of April 2024, wait times were between about 55 to 106 days.
So I think that, we continue to feel like more needs to be done.
Megan Baker is with Disability Law Colorado, who sued the state in 2011 over the wait times and won. She's staying cautiously optimistic.
So I think we've finally gotten enough momentum to start impacting some of the systemic changes that are really required.
The criminal justice system stops when someone is found incompetent. Fewer people on the wait list means fewer delays to cases.
We're feeling like we've made a lot of progress.
So there's a new law in Colorado that hopes to reduce these wait times. It would divert certain people to wraparound services if they've been charged with a low-level crime, and then the courts are required to dismiss those charges once they complete that program, but that program hasn't started yet.
In a sense, this is a bit of a new problem. Before the pandemic, we didn't have such a backlog.
No, so they entered this consent decree in 2019, and they were almost in compliance. Their wait list was down to less than 100 people. So when you think about all the problems that the pandemic came with, it just compounded this issue, and now we have this backlog.
And it is a backlog that they're hoping to clear. Kelly Rinke, slip of the tongue there. Thank you.